who are staying in our jails. At this point, we are 20-25% below our staffing levels. That means the inmates, the people that we in this city talk about social justice, are now ignoring. That means those people are not allowed to see their family because we don't have the staff to let their family in to see them. They are not seeing their children for their parent and child visits. We are not allowing them to come out of their cells. We are not allowing them to communicate. We are not providing the programs, the social justice programs that this city says they believe in. This is San Francisco. You cannot keep us at 25% staffing. Keep the invisible people out of sight in custody and say that this is a city that believes in taking care of people, that believes in taking care of the people that we do not see. We're going to take care of them when we're not going to see them. We're not going to take care of them in the jail because they are then invisible. That is unacceptable for this city. This is not the city that I took employment with. This is not the city that I grew up with Michael Hennessy as perhaps the best sheriff that I thought I would ever see, who believed in programs for people. We need to get back to that. And to get back to that, we need to staff up. If we do not staff up, we are not taking care of the people who need those services, who need to be heard. We're not just talking about us as employees. We're talking about the people that we serve. And to serve them, we have to staff up. Thank you.
I'm Julie. I'm one of the nurses in the emergency room at San Francisco General Hospital.
And today there were hearings around the issue of the lack of full-time nurses, city nurses. What's going on, and why is that the threat to the nurses and the public?
We don't have enough nurses to take care of all the people we need to take care of, especially at the highest quality we'd like to and that we are dedicated to do. They're hiring more and more temporary nurses. They're blaming COVID. They blame it's just too hard. This has been going on before COVID. The lack of accountability is mind-boggling. If I denied the accountability for my job that some of these people deny the accountability for their job, it's mind-boggling. Anyhow, it's not safe to be a nurse right now at the General. We get beat up frequently. There were over 400 reported assaults in a year, most recently. A lot of those are happening in the emergency room because there's no staff. People get frustrated. People come in off the street, psychotic, crisis. We don't have the staff to take care of them. It takes sometimes 6 or 8 people to deal with somebody in a psychotic episode, you know? So it's really hard, and we're trying, but I really don't know where we're going to end up with this. Stay healthy.
And they didn't even have any people there to answer the questions from the city. What does that say about
the CEO? They send the CEO without any data. They didn't even send the CNO, Terry D'Antoni. Why wasn't anybody from nursing there? It was about nursing staff. That CEO's a doctor, an MD. I don't know what they're doing.
I mean, it sounds like a health and safety emergency. Where's Cal OSHA?
That's a good question. They've been there. There's open deficits or charges. Some of them have been rectified, some of them have not. But yeah, it's a good question. Where's Cal OSHA? They should be there.
And this has been going on, you say, for years, even before the pandemic.
Oh, yeah.
You think that that's a policy of the city? Because, I mean, the amount of money that's going into DPH, tremendous. You think it's going to other places other than frontline workers?
There's some questions that need to be answered about where's the money going. Other departments are having the same issues where they're not hiring people. And we're starting to question, is there incentive for the higher-ups to do what they call salary savings for incentives, which means salary savings, they keep positions empty so they don't pay the salary out. So if they're getting incentives to not hire people, that's kind of a conflict in their jaw. That's horrible. The public should know that that's happening.
And doesn't that create a two-tier system when they have temporaries?
Oh, yeah.
They're undermining the regular public employees.
They're undermining multiple things, but definitely union jobs, number one, but also the safety of our community. You know, this is a really complex community that's special in itself, and I couldn't walk into Detroit and be able to deal with that. I would need a lot of education and training, probably. You know, it's not an easy place to work, and I feel sorry for a lot of our travelers. They get beat up and then they get kicked to the curb by the city.
Do you think there needs to be a united campaign against privatization and outsourcing by all public workers?
Oh, absolutely. Yeah, look up, actually, ironically, if you look up Staff Up, there's a company out of Georgia that uses Staff Up to take over DPHs all over the place because, quote, it's so hard to hire permanent civil workers. So there's companies who are banking on that. Heluna's another one. They're from LA. They're working here now, chiseling into our DPH.
HealthRight 360, what are they?
HealthRight 360 is a nonprofit who they're basically doing a lot of our jobs, sadly for a lot less money and less benefits. So they're taking over our jobs and giving people less desirable jobs.
So it's an incentive for the city to contract out to these nonprofits to do.
Multiple.
Do you think there should be a charter amendment in the city and county of San Francisco against contracting out, privatizing jobs?
Absolutely. Absolutely. They've been doing it for a while. They started at the General a while back where Sodexo took over our cafeteria. And then a little bit here, a little bit there. And the funny part about them taking over our cafeteria is they shined up the floor. We got a bunch of really big named products like Kellogg and Ocean Spray, which we didn't have before. And they charged triple what we used to pay. So they privatized it, they charged us more, and they brought in huge corporate food, basically. So it's not good for us. And the workers in the cafeteria, they were suffering when Sodexo took over. A lot of them left.
I think Alameda County, AHS, same thing. They privatized, outsourced it to a private company to run it.
Right.
Privatization, it seems.
Right.
So
basically, yeah, it's like Ubering. And pretty soon you'll go into the hospital and there'll be a nurse there going, well, can you afford an IV? No, you can't. Okay, sorry. And they're going to move on. So if people want good public health, they need to pay attention. It's time. Like, otherwise, don't get hit by a car. Don't get into any trauma. Don't have a heart attack, because we're burnt out and fried and we might not be there. We're losing people fast.
Hey, thanks.
46 nurses have left that emergency room this year. 10, 20 years experience. Stay safe.
Teresa Foglio Ramirez, Public Sector Business Agent, Labor's Local 261.
And this rally today is about understaffing, but also the issue is that they're workers here who are not public workers doing public work. How does that affect itself in San Francisco?
Well, no, by the privatization, I mean, we lose control, obviously, but it's also to undermine the public sector workers, because then they grant out under the guise of workforce development, but there's no true career pathway for these folks. It's under minimum wage, no benefits, but then that's exploitation of a worker, because they want to have that opportunity into being a public employee, but then they just keep granting out or contracting out more and more, so they lose that opportunity altogether.
And these business districts, what are they all about?
The business districts, it's like the butcher who puts his thumb on the scale. So the way that they develop these community benefit districts is, they get the residents and businesses in that area to vote. But everybody who has property in that area gets a vote. So the city has property everywhere. So they're that thumb on the scale that pushes, businesses and residents into being in a community benefits district. That costs them more money for services that the city is already supposed to provide.
And what about the conditions of workers in these business districts?
Once again, I mean, it's minimum wage, no benefits. That's exploitation, because they want a career pathway. They want a good paying job with a pension, with health care, but they're not getting that. It's just, constant. They're going to be there forever, but where's the advancement? Where's that career ladder?
Is that a two-tier system? If they're doing public work at minimum wages, I mean, it threatens basically all public workers.
Yeah, I mean, sometimes it breaks down to 3-tier system, to be honest with you.
It's a 3-tier.
Well, no, you'll have the public worker, but then you'll have somebody who's either in a granted out and like hoping for the workforce development or the community benefits district. So, you know, you have one that's hoping for an opportunity. The other one doesn't even get to have the hope of the opportunity.
What do you think about a charter amendment outlawing privatization and outsourcing in San Francisco, in the city and county?
We need that now. Let's do it now.
My name is Elvis Salad. I work at SFO International Airport. I'm with the custodian, and I've been associated with the union from SFMTA with Local 250A, and now I'm with SEIU 1021. And I tell you, this is a critical moment for us to be out here and to stand firm in what we believe in and what we need because we need better wages and we need benefits and to keep our folks working hard and excited to come to work. So without these benefits, then we'll be kind of like on the side. We don't want to be on the sideline. We want to be in the midst of the action. We don't want to be behind the scenes. We want to be the actors and those that are out there getting those Oscar awards. So it's imperative that those come out. We are out here. It's a friendly setting. Bring your family, your kids. There will be food out here, but let's stand up together, because only together can we make our word be heard, and let's stand firm to get to what we need.
Are you understaffed? Talk about your working conditions.
Yes, we are understaffed. We've been working pretty hard at the airport. We've been having extensions after extensions every day, which means that we've been doing double the work, triple the work, and sometimes quadruple the work. And it looks like we're doing this without any appreciation. They want to chastise us, and not only that, they want to micromanage in what we do, and also they want to make sure they want to pressure us and sometimes intimidate us to get the assignment completed. And under all that duress and stress, one can get sick, and many have gotten sick due to the pandemic and other reasons. And being understaffed is just not the way to go. We need more people there. They need to stop using the temps and hire them, especially if they've been there 5, 10, 20 years, 15 years. They need to hire them, because we need people to start working. We need to stop being understaffed, and we need these. We need a friendly setting without any discrimination, without any hardship, without any targeting or singling out people and making it a hostile workplace, but a friendly and family workplace, so that those can come to work and be happy to come to work to receive the wages and the benefits that they need.
And what are the conditions for the temporary workers? How are they?
The condition for the temporary workers is worse than ours. They put them through a whole lot of stress. They make them work extra, and then when they get to a certain amount of hours, they let them go, and then they call them back when they so that they don't overexceed those hours, and that back and forth is just a very unpleasant situation for them, because a lot of them want to get hired. A lot of them have left because of those arrangements, and they feel that it's not a promising employment or a career. And this is something that needs to be changed, so like that they are not feeling that they're being taken advantage of.
How long have you worked at the airport?
Me, I worked at the airport for about 3 years after my ADA transfer from MTA. I was there for 10 years, and I had a retina detachment due to stress. And so now I'm at the airport for 3 years, and I tell you, it hasn't been easy. It's been an uphill battle, and where I had to constantly defend myself to stay at that position, especially when they put you on probation after you already have been on probation. But because of the transfer, you have to do a 6-month probation, and then that's when the game starts. Here comes the intimidation, here comes the micromanaging, and here comes the evaluation to give you low scores so they can dismiss you. And if you get sick or you're on any sick leave, you got to be careful with that too. If you're on an ADA disability leave or on a transfer, you have to be careful with that too, because with that they want to try to classify you and excuse you from work on medical on those medical conditions. I forgot the phrase that to use.
Disability?
No, it's actually not disability. It's well, when it comes to me, I'll let you know. But it's all a distressing situation for those that are being there to discourage them not to be there and to get rid of them.
Hi, my name is Tia Panit. I'm a registered nurse here for the City of San Francisco Department of Public Health. I don't work at SF General Hospital, but I was here supporting other nurses that work at General Hospital. But I actually work here in the community for people experiencing homelessness in the shelter streets, hotels, permanent supportive housing, whatnot. We were here today to discuss the staffing shortages here in the city, because it still continues to be a crisis. It was a crisis pre-COVID, and it continues to be. We are demanding better transparency around the hiring process and through HR, and how to expedite it. It shouldn't take 6 months to get hired. So, obviously a lot of us nurses are burned out. It's still a pandemic. It's not over. We're still dealing with this every day. I was getting people vaccinated before I even came here, so it's still a thing. So yeah, and I feel like the city of San Francisco has not done enough to acknowledge the nurses and the frontline workers that have taken care of this city. I said, the mayor and city officials like to brag about how we have the lowest death rates and vaccination rates, and that's been the nurses and frontline workers who have been the backbone of this. So I said it's time to staff up, it's time to pay up, and we'd like a pandemic stipend hero pay as a symbol of thank you. I was given a round of applause in a meeting. That's not good enough. Every city worker here in San Francisco deserves a stipend pay for this. We are not done. We are still not fully prepared for the next pandemic or an earthquake. So I think there's a lot of lessons that have been learned. And yeah, just the hiring process. And that's it. That's all I have. Thank you.
It's part of privatization and outsourcing? What is that?
I know there's a lot of, they approved a $59 million contract for travel nurses. We don't have, I know they're doing a salary schedule analysis. I don't know what that is, but I know that we make less than some of the private sectors here. So yeah.
Cheryl Thornton. There's a rally here today with all the locals, SEIU 10-1, Local 21, and some other unions. And they're saying here, staff up San Francisco. It's odd though, because many of the job announcements that I'm seeing online, they're all permanent exempt. So that leads me to believe that they're hiring people outside. Those people are outside of the city charter. They're not civil service, and they don't have the protection under civil service. And I'm not sure if they even get a retirement. But it sounds like privatization on the under to me. Because why aren't we talking about our raises and more money? The inflation is out of sight, 7%. Many of the workers that are in my union, we can't not telecommute. And we have to bear the full cost of driving across the bridge, the transportation costs. And it's heavy. And a lot of these managers and other people of privilege, they get to telecommute and save, and they don't have to bear the cost of all of this. So yeah, we need our 7%. And I'm not understanding why we're not talking about out here raises. And then the other thing is, I'm glad these other unions, this other group is out here talking about the vaccine. You know, I mean, it's really odd that in San Francisco, you know, this is the mandate, but that if you're a state worker working, in case in point, if you work for the city, you have to be fully vaccinated or lose your job April 1 like Kim Cox. But if you just go right down the street to the school district, you know, they have an option. And I think given that we're the highest vaccinated city, we should allow people those to have fair accommodations. So.
And are they doing testing?
No testing here in San Francisco at all that I know of. I work at 230 Golden Gate, Tom Waddell Urban Health Center, and I haven't seen any testing for employees, no.
And you're running for president of the Labor Council. What would you do if you were elected as president?
Well, the first thing is to build a grassroots education, educate the members about what's going on with the privatization, you know, and what's really at stake. And then how do we put a campaign together to fight the politicians and the developers against the privatization in San Francisco. San Francisco used to be a working class city. No longer. Everybody's being pushed out. You know, they can't build enough housing, the affordable housing, and that means the prices of homes keep going up here and nobody can live here.
$1 million condos.
$1 million condos. And so we have to take our city back and figure out strategies that work so that people can get housing. And that might mean going up higher, building up. But we have to house people, and we have to get a hold of this homeless problem. And we're not going to get rid of this unhoused problem until we figure out how to get more demand, more supply than demand for housing. So, but that's privatization too. All those are under privatization. They don't want to build enough housing so they can drive up the cost, you see? And that this is about, because they just want their properties to go up. And this is happening across the nation.
You were working in the Potrero neighborhood at the Neighborhood Health Center. What's going on with gentrification there?
Well, so they have a Hope SF site up there. And the Hope SF site, once people leave the public housing that's been there, the dilapidated housing since 1930, and they go into the new housing, then what happens is they sign a RAD, and that's private housing. The land has been leased to the developer, and they built a building. And what's going on up there is the same thing, privatization. You see people are losing housing. I think I heard something from Matt Haney today or yesterday saying that a lot of the unhoused population were formerly public housing residents. And so that tells you, I mean, they can't stay here anymore with this. They're forcing them out with this privatization.
And the racism, is that systemic racism in Hunters Point and Treasure Island, the condos on that, development on the radiation nuclear dump? You had clients that were coming in that were sick?
So that's been the case now, since the workers came to the Bayview Hunters Point shipyard 20 years later or so. They started getting sick, and it's been ongoing. All you have to do is look at the health data: more cancer, more asthma, and this stuff has gotten into people. It got into people's DNA, so it's actually even in their descendants now. That's what we see, and I see many people coming in sick, and then they can't get access to care. That's another thing. It's getting hard to get access to medical care. And
you think we should have national health care? Get rid of the insurance companies?
We need one payer for everybody, and we do need national health care, because health care, as we see in the pandemic, it was the people who didn't have it, they were stuck in the emergency room, and then they couldn't take care of who they had, the sickest. And some people's needs went unmet, or they stayed in the emergency room longer waiting for care because there were so many people that were uninsured. And they didn't have a primary care doctor to call when they start first feeling sick. So they waited, and then by the time they got there, they were really sick and probably died, some of them.
And even one of your workmates died, Ludwig Lieto?
Yeah, Ludwig Leoto, a good brother in the fight. He was in the trenches with us for the first 15 months of the pandemic. And yeah, he contracted COVID, we believe, at work. And he passed away 19 days later. And he's another one that didn't get an accommodation. He should have been at home. And he wasn't at home, telecommuting. He didn't have that privilege because of systemic racism, I believe. There was no other reason.
And these are the issues you're going to bring up in the Labor Council?
Yes, these and more. But like I said, we have to put together a campaign to educate our members about all this privatization, because it's going to ruin our city.
My name is Ramon Galdames. Well, one of the reasons we are here because we're fighting for the wages, higher wages.
And the inflation, I mean, it's making it very difficult to survive.
Well, I tell you what, if we get 4%, it's going to be hitting overnight because, you know, gas prices go up basically $1 overnight.
And what is it going to take to get them to do it? The city has a lot of money, but it seems like they don't want to come up with it.
Well, you know what it takes basically is to put pressure on themselves and to come together and tell them, you know what, this cannot happen. This is not reasonable for us.
Okay, thanks. How long have you been a transit worker?
21 years.
21 years. Hard to survive.
Hard to survive, that's correct, that's correct.
My name's Dana. I'm a nurse in the ICU at San Francisco General Hospital. We are here so that we can bring awareness to the struggles that we're having there, where we need a lot more staff, we need help, we're having a really hard time.
And is this a threat to your health and safety and the health and safety of the public who go to the hospital?
Absolutely. Yeah, absolutely.
Talk about some experiences you've had.
I've had a lot of experiences recently with having just no staff and not having enough resources and help. So like our patients are really suffering because of that.
And there was a hearing today.
Yes.
No, apparently the city didn't even bring the person that has the figures.
Of course not. No. They play this game constantly. They love to do this. And then they say, we'll circle back to it and get it done, but they never actually do anything about it. I mean,
isn't that kind of contempt for even the city?
Yeah, it's a stalling tactic ultimately. It's they don't want to negotiate with us. They like things the way they are now, but they don't realize that the crisis was here before the pandemic, and it's going to be here afterwards if they don't. It's going to be much worse here soon if they don't do something about it.
And they do bring in nurses from outside.
Yeah.
Is that creating a two-tier situation? What does that do?
So what it does ultimately is it makes them not have to pay all the benefits and the pension and everything, which a lot of us there were at the general because of that. But what happens with these travelers and these per diem nurses come in, they are a lot cheaper for them in the long run because they don't have to pay out all the benefits. And I'm a big believer that a nurse is a nurse. I appreciate all the help that we get, but in the long run, we need these long-term nurses that are going to sign on and stay with us and be a part of our community, because if they are not going to be a part of the community, then the community is going to suffer. And somebody that's a part of this community, I really would prefer to have these full-time staff members so that we can keep up the great hospital that is San Francisco General. It really sets the standard for nursing care throughout a lot of the country. We are like the #1 trauma center, #1 neuro center. Like, we are a huge deal, but we cannot maintain that standard if we don't have the staff that we deserve.
Well, there's a lot of money coming into the Department of Public Health.
Yeah. So we have a surplus for the first time in like 20 years of like over $100 million. But they don't want to do anything. They want to hold on to that money, or they want to send it to who they want to send it to. But it's an easy fix. It just takes a portion of that and do a mass hiring of full-time nurses and get us the help that we need.
You think it's going to take a strike to do that?
I think it is, yeah. I don't think that they want to budge, and we're not going to be treated like this anymore.
And are they creating a two-tier system in San Francisco?
What do you mean by a two-tier system?
People are brought in, less benefits, less like the pensions and everything else.
Yeah.
So thereby they're undermining the public workforce.
Absolutely, yes. And I think that's easier for them, and that's an easy fix. So they get to say, oh, we did our job, here's the staff that you need. Oh, and also we don't have to pay out these benefits. So yeah, I think that they're trying to create that kind of, and they don't want, I really believe that they don't want the full-time staff anymore. I think they would love to have just part-time staff so that they can decide what to do with the union in the end.
Hi, I'm Emily Marika Sanders, and I'm a temporary health worker with the Department of Public Health, and it's taken me it was 6 months for me to even get this job, which was temporary, and I would like to be considered for a permanent position, and I have no better option than the folks that are applying as unknowns at the positions that are available. I would appreciate it if temporary positions we weren't being hired in temporary positions, that we were being hired for permanent positions, and positions that don't take over a year to get from application to offer. Thank you.
What does it mean to be a temporary worker? Talk about
being a temporary worker means that you don't have access to the same benefits as a regular employee. You don't have the stability or the consistency that a permanent employee would have, and also not the same options in terms of wage increases. There are more it seems in our division, more temporary workers than permanent workers, which is highly problematic, and it means that people are constantly having to look for jobs instead of being able to focus on the work that needs to be done. So and as part of a team.
Hi, my name is Brenda Barrows, and I'm here because I'm in support of the temporary workers, workers who are being abused in the workplace. And it is just getting outrageous and ridiculous, and it's time for it to stop. So to everybody listening, you need to support the workers. The workers work really, really hard. We've been working through COVID, and it's gotten to the point to where we've had enough. Privatization is really affecting the Department of Public Health. We see more and more contractors, people who are not city employees. These people end up with authority over city employees, and they're abusive to city employees, and there's no way absolutely to hold them accountable.
Hi, I'm Sandra Scott. I'm an employee of In-Home Support Services as a social worker for 16 years with the County of San Francisco, and one of the biggest concerns is all of the outsourcing and the resources that the city and county has, that they're doing a lot of temporary assignments versus pulling employees for reassignment or having them to be promoted into promotional positions, and this is something that really needs to be addressed within the city of San Francisco. So the public services are being affected by the temporary workers because it's a constant change of hands. Once their contract is up, that particular program is no longer available, so that service is no longer available to the community. The community needs stability as well as the county employees. We also need stability, and we need to be given the opportunity to be promoted into these promotional positions opposed to them being outsourced to agencies on a temporary basis.
Who are these outsourced agencies?
There's many different agencies. There's Meta, there's Helena Health, there's Catholic Charities. There's a number of different agencies. Those are just to name a few. But in order for us to take back what we should be able to be a part of, is going to take the community, the whole entire city force, so that we can also be part of the growth within the city.
You think there should be a charter outlawing outsourcing and privatization, charter amendment, so that they can't do it?
It shouldn't, yes and no. They should be able to do that, but offer the promotional positions to the county workers before outsourcing them.